So good evening, everyone. Let's begin with today's session without wasting much of time because I know your time is very important. And this is the end of the day, and you still have to keep that energy to hear this session. So let's make it sharp and more of informative learning process. I'm sharing the screen. Right, so you are able to see the screen now. Let's start with a quick revision of the earlier session so that you'll have a broader idea. See, the reason we are doing this is we need to understand the yoga postures and its proper sequencing. See, one general sequencing, what we have learned during our practice, or if you are still a student and you are doing it every day, you may be following a certain sequence every day. And mostly followed sequence is a standing, supine, prone, and sitting sequence, finally followed by the advanced postures. So the reason of understanding muscles so that you can what posture has to be placed next, especially when you are taking therapy classes or even if you are taking classes for common public and you intend for the various objectives like basically strengthening, or you want to give a deeper stretch, or suppose you want to focus on their digestive system, or you want to improve their stamina, skill, or you want to focus on weight loss. So the right sequencing of postures are going to help. So let me quickly revise what are some muscles will be taking these names very often. So if you are not aware of it, so you'll find it new. So few are the important groups. Normally we revise in every session, but let me just quickly go through it. The first set is a quadriceps, which is made up of four muscles. So names are mentioned, the rectus femoris and the vastus group of muscles. Then you also have an important muscle called as sartorius, the longest muscle, which is normally necessary for external rotation of the hip, especially when you do vrikshasana. So you need external rotation of the hip. Then coming to another important muscle group, which is called as hamstring. So, these are the muscles which tend to get stiff because of many reasons. So these are again three muscles, but the bicep femoris that has two tendons. So bicep femoris, semitendinosus and semimembranosus. Then the third group is which is found to be tight in youngsters, students, children who tend to sit for longer time studying, or in fact, all those people who sit for longer time, they find their adductor muscles to be tight. What are those muscles? Again, the group, the adductor longus, brevis, magnus, and apart from that, gracilis and pectineus. The fourth group of muscle, which is a very again important muscle, which is the outer thigh, which is called as TFL band, tensor fasciae latae, and gluteus medius and gluteus minimus. And of course, at arms, every one of us know that biceps, triceps, and deltoid, which is the thick muscle over the shoulder. And at the back, you have some important muscles, trapezius, erectospinae, rhomboids, levator scapulae, and latissimus dorsi. See, all these muscles will come into display when I'll be displaying about different postures. Then you need to importantly understand the four abdominal muscles. And I last time also had given a formula to remember it. That is by TIRE, TIRE. That means T for transverse abdominis, I for internal oblique, R for rectus abdominis, and E for external oblique. So if you remember the word tire, you can easily remember the four important muscles of abdomen. Okay, so these are the muscles you need to understand while you are understanding about the anatomy of any yoga posture. So now coming to a quick revision of what we have learned till now. Um, See, just a visual representation of muscles of front thigh, which we call as quadriceps. So that group can be seen over here. Then you have the hamstrings. Of course, here you can see um, the muscles, the biceps, femoris longus, semitendinosus, and semimembranosus, which are called as hamstrings. And then you have the inner thighs, what we call as adductors, just for a visual representation, a short visual representation. I think this can be revised by you later also. And of course, the outer thigh muscles, abductors, which are importantly the TFL, tensile fascia latae, and gluteus medius and minimus. So, what all postures we have learned till now? We have asked for the recording. Yes, you will get the recording. If you have, you will receive on your email. Once the session is complete, you will receive the recording. Okay, yeah. So as of now, we have completed few postures. Utkatasana. This, if you want to get a detail about it, you can see the previous recorded versions of the session. If you have not seen that, you can ask for the recordings. Trikonasana. We learned about Utthan Padasana. We learned about Bhujangasana. Today also there will be, because we are discussing about backward bending, so we will be revising Bhujangasana. Apart from that, frog pose, Mandukasana, which is for adductor muscles. And the last session, we discussed about the balancing postures. What are balancing postures? We took Vrikshasana, Natarajasana. If you have not seen the recording, you can ask for the recording. We'll share you the link. Veerbhadrasana 1, Veerbhadrasana 2, Veerbhadrasana 3, Ek Pad Utkatasana. Again, this is a very good posture for students. And students should regularly practice this posture. Then Uttida Hasta Pad Angushthasana, Parivit Trikonasana. So these were the postures covered till the last session. Now coming to today's session, after a quick revision of what we had done earlier, let's give a quick move to our today's session. Today we are learning about backward bending postures. You know, most of us, we ask people to perform Setu Asana, Bhujangasana, Shalvasana, and we are aware that that is for strengthening your back. We are aware that helps to stretch the abdomen and the majorly psoas muscle, iliacus muscles. So today let's have a visual understanding of how and what actual muscles are involved while doing the backward bending postures. So this will definitely help you to improvise your yoga practice as well as your teaching techniques. As well as today I am telling about the sequencing of postures, the basics I will be dealing you. But let's quickly go through the backward bending postures. The first posture we are taking here is Chakrasana. So let me quickly ask, how many of you are able to do Chakrasana? Write one if you are able to do Chakrasana. Great, 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 great. So I'm getting a good response from everyone. Most of you are able to perform Chakrasana. That's good, that's good. Asmita and Mahendra, Dr. Ananta, great. Dr. Kamlesh Arya, perfect. So let's understand more about this Chakrasana. So while you are seeing the posture, you need to understand two important things. The muscles marked in yellow are the muscles which are getting stretched, and the muscles marked in red are the contracting ones. And the muscles you see as a pink, basically these are stabilizer muscles. So they are not fully active, but they are helping to stabilize the posture. So that's how you can demarcate your learning yellow, red, and pink. Okay. So while you're doing chakrasana, what are the muscles which are getting stretched and what are the muscles which are getting contracted? So let's have a learning about it. So if you see the three important muscles which are getting active here, one you see here red is the gluteus maximus. It should contract. So while you're in chakrasana, make sure to contract your buttocks properly. Second muscle is the deltoid. You can see over here that is contracting. And the third muscle is the triceps. Triceps brachii. Apart from this, here the quadriceps femoris is acting as a stabilizer muscle. So these are the muscles contracted to perform the action. So there will be good strengthening of the body, right? Now let's see what are the muscles which are getting stretched. For this, we'll see two angles. One from the anterior angle, one from the front back angle, posterior angle. So if you see here, um, what are the muscles over here? So if you see here the abdominal muscles, this is rectus abdominis, which you are seeing over here. This is the pectoralis muscles, which you are seeing over here, right? And these are the wrist flexors. To name few, I can just quickly say about flexor carpi radialis, flexor carpi ulnaris. So these are basically wrist flexors. So these are the muscles which are getting stretched. Now let's have a another view. Here we find intercostal muscles also getting stretched in this particular posture. If we see here, this is the sternocleidomastoid, which is getting stretched. The long muscle, my arrow is moving. And another one here stretched is longus colli. So now you can clearly demarcate these are the muscles which are contracted, stretched. Now let's see another view. Now, if you see through the leg end, you will find the stretch of the TFL, which is abductors. You will find stretch of the sartorius. You will simultaneously find stretch of the rectus femoris. See, out of quadriceps, rectus is one of the muscle, right? So, just I'll take you quickly to the first. See, this outer thigh are the stabilizing ones, but these are the other three muscles. So rectus femoris is getting stretched. Apart from that, you can see that psoas major and the iliacus, which is near to the iliac bone, is getting stretched. I think this makes a quick, clear picture. The muscles getting contracted and the muscles getting stretched, both at the level of hands, chest, abdomen, and at the level of legs. If you want to revise, you can quickly revise it in your recording session, right? Let's move to the second posture of the day. If at all you have any doubts, you can just write it down with you and you can ask at the end so that there will be no interruption in between and we'll quickly go through the postures first. The second posture what we are learning is again a most simple posture, most practiced posture, which is called as Setu Asana. And Setu Asana, you can say that it is a preparatory posture for those who are not able to practice Chakrasana. So what are the muscles which are involved doing this Setu Asana? Is it same like Chakrasana or there is difference? Let's say it. Because please do not annotate. Okay. Now let's see the muscles which are getting contracted. Okay. So here you see the gluteus maximus muscle, the most thickest muscle of the body is strongly getting contracted. So if you are performing Setu make sure to contract your buttocks properly to perform. And even if you are teaching to your patients, that will only help them to relieve their back pain. And the second group of muscles which are getting contracted over here, you can see these are the spinal spine erector muscles. I'll be telling you in detail about this. Okay, erector spinal group of muscles. Now coming to the muscles which are getting stretched over here. So you can see the rectus abdominis muscle which is getting stretched. You can see this pink muscle. I had earlier told red contraction, yellow stretching, and pink is stabilizer. So here quadriceps is stabilizing. There is stretch of the pectoralis muscle. So it's a visual representation, so it will be easy for you to remember. So these are the muscles getting stretched. Now, coming to the third posture. So this was about Setu Asana, the muscles getting contracted and muscles getting stretched. If at all you have doubt, you can again ask in the end. Coming to the third backward bending posture. See, the reason we're doing it one by one, you are able to visualize it, you are able to see it for a longer time. And we have many postures to be done, and it's evening time, so I want to be sharp and crisp while learning, because I know your time is important, and learning is always maximum 50 to 60 minutes. Then coming to Matsyasana. So yeah, everyone is aware that this complementary posture of Sarvangasana, and one should perform after Sarvangasana. So let's understand. May I know who is annotating again and again? Please do not do it. It is consuming time and it is disturbing. Okay. Let's understand what are the muscles which are getting stretched and what are the muscles getting contracted. So let's have a visual view. So the muscles which are getting contracted are the erector spinae muscles. The muscles, basically the deltoid and infraspinatus, it is helping to rotate the shoulder outwards. Then you see the trapezius muscle that is also getting active. That is also helping to pull the shoulders backwards, so that basically you can expand your chest in this posture. So that will help to expand the posture properly. Now coming to the muscles which are getting stretched. So you can clearly see the abdominal muscles are getting stretched and the pectoralis major and minor getting stretched. So by now, one thing will be clear: in most of the backward bendings, the muscles in the back, especially the glutes, the erector spinae, trapezius, these are getting contracted and the front of the body is getting stretched. You'll see more postures and more difference in the way the muscles are involved. Now coming to Bhujangasana. So when you see Bhujangasana, what is the target muscle for Bhujangasana? Why are we practicing Bhujangasana? We are practicing Bhujangasana to basically strengthen this erector spinae group of muscles. because these muscles have two important roles. First, they stabilize the spine. At the same time, most of the people who sit for longer time, they tend to round their back. The rounding of the back, and sometimes people are suffering from a major issue called as kyphosis. Um, Kyphosis is nothing but a medical condition where spine bends forward. So this particular muscle helps to strengthen the entire back, but simultaneously it helps to keep the paraspinal muscles relaxed. Let's see what are the muscles which are getting contracted and stretched. So the contracted muscles are, of course, here you can see this is erector spinae, which is getting contracted. But what are the muscles which are lengthening? It are the abdominal muscles over here. We can see yellow. Apart from that, psoas major and iliacus. See, I'll be clearly showing about psoas major and iliacus in upcoming postures because we'll have a more clear view of those muscles. So basically, those people who want to basically stretch the abdomen and the front of the thigh, they need to practice this. Psoas major and iliacus, they tend to get contracted, causing our deformity of postures. So this posture helps in improving that. Let's have this view now. So can you see over here the iliopsoas muscle over here, how it is getting stretched, how it is basically in the posterior line, and then you can find the rectus abdominis muscles which are getting stretched. So basically, it is beautifully stretching. So the right alignment of doing the posture, you have to keep the elbow fold at right alignment. The shoulder should be retracted. It should be down. Chest should be wide open. And then the actual muscles will involve. So the lengthening muscles will be the abdominal muscles, iliopsoas, psoas, and iliacus muscles. Now coming to the complementary, either you do practice Shalbhasana or you do Vipreet Naukasana. This posture is also called as Shalbhasana in some of the books, but let's learn it as Vipreet Naukasana. In this Vipreet Naukasana, let's find out quickly what are the muscles which are getting contracted and what are muscles which are getting stretched. See, muscles seen in red are contracted ones. You can clearly see the glutes are contracted, erector spinae are contracted, and again the front of the body needs is getting a stretch. In spite of the balance on the abdominal muscles are getting stretched while you are inhaling. While exhaling, the abdominal muscles will contract. So let's have a view over here. So what are muscles getting contracted? So the erector spinal muscles, which is running by the side of the spinal column, both the gluteus maximus, and you can see the calf muscles and the hamstrings are the stabilizer muscles. So in fact, these muscles should be also contracted so that you can perform your posture properly. So these are the muscles which are getting contracted, the gluteus and the erector spinae along with the neck. Now, as you're raising your hands, you will find that your deltoid is also getting contracted. Apart from that, you can see over here, the trapezius muscles is also getting contracted. So basically, most of the people who use mobile for longer time and who sit and do desk work, their trapezius is very tight. So if you tend to practice these postures, the trapezius will get relaxed. Everyone is aware of that concept, the contraction followed by relaxation, the proprioceptive release method. So while you perform a posture for a specific time, suppose this posture is performed for some 30 seconds, in that scenario, what will happen? Um, there will be quick contraction of the muscles, and once the muscles contract, while you are relaxing in the posture, these muscles will automatically get relaxed. This is the relaxation which is followed by any stronger contraction or short duration contraction of muscle. So these postures can be practiced initially for the person who are suffering from pain for 30 seconds. And then that 30-second can be repeated for 2 or 3 times. Now let's see more clear vision of the erector spinae group of muscles. What are those? See, you can see the spinalis thoracis, longissimus, and iliocostalis. And apart from that, you can see over the neck, the splenius capitis muscle. So these are the muscles getting contracted. I just wanted to show you a clear view what are the actual muscles getting involved while doing the posture. So that should help you to understand. So some of us, sometimes we just lift the body and we are not completely aware of our muscular action. So we are not giving best of our efforts. So now when you are aware of the muscles, while you are actually practicing the posture, you should make sure that you are utilizing these muscles. Then only you will learn to do it in right way. And once we tend to do in right way, we can teach right things. Right? That is the important thing. So this is how the Vipreet Nauka Asana is helpful. Now coming to another posture called as another backward bending posture, Dhanurasana. In Dhanurasana, you find the two group of muscles. One is the muscles which are getting lengthened and another muscles which are stabilizing this posture because you're trying to balance your body on basically on the navel. At the same time, because you're breathing, whenever your abdomen will contract, you may tend to bit release the posture. So here the quadriceps come into a role. They help to stabilize the posture. So keeping the weight around quadriceps initially and then trying to expand the chest will give you a better posture. Let's see the understanding of the muscles getting contracted and stretched. So if you see the front view, you can clearly see that the pectoralis major and the minor are getting stretched. Then you're also seeing here a bit of bicep is getting a stretch. Apart from that, you can see the abdominal muscles marked in yellow are getting stretched. Again, the psoas major and iliacus are getting stretched. And you can see this, the rectus femoris also getting stretched over here. Let's have another view. Now, this has stabilizer muscles. So what are the stabilizer muscles? So you can see over here the trapezius is basically helping to perform this posture. Here the erector spinae is less used and more stabilization is done by the gluteus maximus, but they are not actively contracting. At the same time, the quadriceps group of muscle, they are stabilizing, but rectus over here you are seeing is getting stretched. So you know quadriceps is 4 group of muscles. So one muscle is getting a stretch, but other 3 are stabilizing the posture. See, not the entire quadricep is stretching. Only one of the quadricep muscle is stretching. Other 3 muscles of quadriceps are stabilizing the posture. So you can clearly understand. Now, Dhanurasana has a more stretch effect on the abdomen, pectorals, that is chest. Same times you have the psoas muscles, iliacus muscle, and the bicep you are getting stretched. And the tibialis anterior to an extent you can find it getting stretched. Right? So this is about Dhanurasana. Now, before we move to this posture, how many of you are able to do this posture? Ek Pad Raj Kapotasana. Right? I I am able to do. I am able to do it. Just write down if you are able to do this posture. Okay. Asmita can do it. Okay. Yogeshwari ji can do it. Then Raj can do it. I am able to do it slightly. Okay. Millie is able to do it. Great. B. Kavya is able to do it. Good. That means you have a excellent flexibility and stretchability body. Dr. Disha also is able to practice it. Great. Very happy to hear that you have such excellent practitioners with us. So let's learn what all muscles are getting active in this. So if you see this posture, you can clearly see one quick thing. Most of the muscles are getting stretched. Most of the muscles are getting stretched. Okay, those who are not able to do this posture, what they should do? They should practice Ardha Ekpad Raj Kapotasana. How that will be performed? That will be performed by keeping the back leg straight. If you keep the back leg straight and just bend forward, in that scenario, most of the muscle around the legs will get stretched. So those who find difficulty in forward bending, they should practice these postures. Then their forward bending will improve and they'll be able to touch their chin ahead of the knee. So basically, you don't have to always touch the forehead towards the knee. You have to get the chin so that there is a right alignment over the spine. So what are the muscles getting lengthened in this posture? This backward bending posture involves stretch of the gluteus maximus. You can clearly see over here the gluteus medius and gluteus minimus also. Apart from that, piriformis muscle is also getting stretched. You can see clearly rectus abdominis muscle getting stretched. Then deep there you have the iliacus, psoas major and minor, that also getting stretched. Here you can see the tibialis anterior muscle getting stretched. Here you find latissimus dorsi, where I'm moving my arrow, is getting stretched. And apart from that, the pectorals are getting stretched. And the same time, the arms and the triceps also getting stretched. Right? So the close to these muscles are getting stretched. And what are the stabilizer muscle? Let's look into it. The stabilizer muscles are here are basically erector spinae and the diaphragm. That erector spinae group already we have seen in the last posture Viparita Naukasana. I gave you the clear vision of those muscles. See, this is how it looks from front. The clear stretching of muscles, maximum muscles are getting stretched. Now, coming to next posture, which is Urdhmukh Shvanasana. Urdhmukh Shvanasana, of course, this is one of the best posture if you actually looking for a good flexibility in your body. Then you should practice combination of Urdhmukh Shvanasana and Parvat Asana. You should repeat only these two postures some 8 to 16 times. And after repetition, you should hold these postures for minimum of 1 minute, both Urdhmukh Shvanasana and Adhomukh Shvanasana. You will find your body flexibility rising up to more than 40 to 50% because it will be stretch opening most of the important muscles. So let's see what are the muscles getting contracted and what are the muscles getting stretched. So if you see Urdhmukh Shvanasana, the muscles which are getting lengthened are abdominal muscles, the psoas major, and the iliacus. And the muscles which are getting contracted are erector spinae and gluteus maximus. See, most of the people who sit for longer time, their gluteus maximus tend to get weak. Reason of getting weak? When you sit for longer time, it will be in a contracted state. The blood flow to the muscles will be less. And so the muscles fiber will tend to get dead. That's why do not sit for longer time. Every 1 hour, one should take a break. Else, you are damaging your important muscles. And if this is getting shortened up because of long sitting, it will directly affect your hamstring. Because the origin and insertions are close by, it will cause difficulty in forward bending. So if you keep your gluteus maximus strong, see, most of the people who are doing gym, they are trying to uh, strengthen these gluteus because that basically helps them to lift the weights. So as a student, make sure if you are sitting for a long time, you should strengthen this gluteus maximus because that will improve your forward bending apart from backward bending. Let's have a, just a second. So you can see rectus spinae and the gluteus maximus marked in red are getting a good contraction. And of course, the muscles, by now we have understood that abdominal muscles and the psoas major and iliacus are getting stretched. Now coming to another view of this. You can see the erector spinae muscles. They are basically helping the thoracic region to help the chest protrude outwards, and that will be a proper protrusion of chest. Then only the abdominals will get stretched, especially the rectus abdominis muscle. The iliopsoas will get stretched. Rectus femoris will get stretched. So whenever you're doing this posture, out of the four muscles of quadricep, one is getting stretched, other three are stabilizing it. Great. So now this clearly remarks it's not necessary when we are doing a backward bending, then always all the muscles of quadricep will stretch. In fact, we saw in Dhanurasana also. So what is the best method to stretch the entire quadricep? That posture is called as Supta Vajrasana. So most of you have practiced that Supta Vajrasana. That Supta Vajrasana is a quick stretch to all the four quadricep muscles. Now coming to the next and the most important posture, looks simple, but those who are suffering from kyphosis and rounded back, those people who start with the yoga, suppose you are senior and you take a session for your juniors, those coming into first year or second years, and if you find them basically stiff, and while they are doing forward bending it, and they are while they are bending to 90 degree, and you found that their back is getting round, then the best way to correct their back will be to make them perform this Salam Bhujangasana. This looks simple, but believe me, I make my most of the back pain patients to practice this for minimum 1.5 minutes every day, and they have overcome their back pain issues. They are able to bend properly. Earlier, they thought that if I have back pain, because most of the doctors have advised me not to bend forward, but we help them to overcome all their shortcomings and they are able to practice it properly. So make the youngsters, the students to practice this. Of course, the lengthening muscles are clear, the abdominals, psoas major and iliacus. So by now, one thing is clear. Most of the backward bending posture, abdominals are getting stretched and psoas major and iliacus are getting stretched. Most of the backward bending postures, you find the erector spinae group of muscles getting contracted and some of the muscles acts as stabilizers. Right here, latissimus dorsi and lower trapezius, they are acting as stabilizers. You can see over here. The latissimus dorsi, they are acting to make the chest open. The iliopsoas is getting stretched. The trapezius is acting again to pull the scapula down and close to the chest cavity. The pelvic floor muscles maintaining the intra-abdominal pressure. So help everyone with this posture. Ask them to do this. Salam Bhujangasana. Looks simple but effective. Coming to another posture, backward bending. So we'll be finishing the session in 1 hour. So I am making sure that we complete all the important backward bending postures. Now, Ustrasana is a challenging posture. Ustrasana demands a lot of challenge with the stabilizers, and lengthening group of muscles. So what are the muscles getting stretched in Ustrasana? Let's have a view. The muscles getting stretched are the pectoralis muscles. You find the triceps brachii muscles getting stretched, right? You find the rectus abdominis muscles getting stretched. And what are the muscles? Apart from that, the anterior deltoid is also getting stretched. Pectoralis major and minor. What are the muscles getting contracted? So again, I'll show you lengthening muscles. The lengthening muscles are the iliopsoas, rectus femoris over here. Okay, this is quadriceps which are getting contracted. Only one muscle is getting stretched out of the four muscles. So most of the backward bending, you saw this phenomenon. Rectus femoris is getting stretched, but other three muscles are getting contracted. Please remember this so that you will help the people to do the posture rightly, so that they don't put strain on their knee while doing this posture. And apart from that, biceps brachii muscle, which is getting stretched. So in Ustrasana, these are the muscles getting stretched, apart from abdominal muscles. So, and muscles getting contracted, of course, you can see over here that stabilizer muscles are the erector spinae. You can see the serratus anterior over here, which is getting stabilizing the muscles. The pelvic diaphragm is helping over here. The latissimus dorsi is also getting contraction, and the lower trapezius over here is also getting contraction. Now the last posture, then we'll go to sequence of yoga postures. Now this should be done at the end of the most of the backward bending postures, especially done in prone. And this is called as extended puppy pose, also called as Uttan Shishu Asana. Extended child pose also it is called as. So basically it is just for strengthening. What are the muscles it is strengthening? It is strengthening basically the spinal muscles, but the stretched muscles are the abdomen again. See, even though this is a forward bending, but still this is stretching the abdomen. So the reason of taking this posture in the backward bending group of postures, because in spite of forward bending, there is no contraction of abdominal muscles, there is stretch of the abdominal muscles. At the same time, it is helping to stretch. The most of the time, people are not able to lift their hands straight. Suppose people doing Surya Namaskar, and when they raise their hands, if they find that their elbow is getting bent, or suppose they are performing Ardhakati Chakrasana and they find that their elbow is getting bent, the reason is because of this lattice. And in last session about the Vrikshasana and balancing posture, those postures help to stretch this lattice. The lats, when stretched, it will help to improve the hand raising. So this extended child pose helps to stretch the front group of muscles as well as back group of muscles. See, you have always learned when you are doing any posture, one group will be contracting and one will be stretching. But in this, there is slight contradiction. Here, the front and the back groups are still into stretch zone. You can see the front view. The pectoralis rectus, pectoralis minor, they are getting a stretch. And of course, latissimus is also getting stretched. So this was quickly about most of the important backward bending postures. Maybe I would have gone quick because we have to keep the session crisp and sharp for 1 hour. So if you feel that you need to revise what we have learned today, we'll share the recording on your email. So you'll get the recording so you can revise your session and see again which muscle involves, which posture involves which muscles. Okay. So from here we stop the share and let me just give you a quick sequencing plan. I'll share you the most basic sequencing plan for the day. The stretch program. So the first part was about the backward bending posture. The second part is let's quickly learn about the simple sequencing of postures. Now, I just made it as a flow chart. Let me take you there quickly so that you can understand it. I will make you towards the flow chart section. Just a second. Okay, let's see the practice flow. So, how one should start? There are two things one can do. The person comes to the yoga mat, they should entirely stretch the spine with this Tadasana. After the Tadasana, they can do the Tiryak Tadasana, again activating the paraspinal muscles. These asanas are not dealt for you as of now, so later you will be understanding all these postures also. Or what you can do is you can start sitting, do all the ankle movements, knee flexion and extension. Then, if you want to improve your butterfly, you need to practice this Shishupal every day. In my session, I make sure to practice Shishupal. So while you practicing this Shishupal, you will improve your Paschimottanasana. So if you want to improve your Paschimottanasana, make sure to practice. What will this posture do? This posture will help to stretch the gluteus maximus. So because of the gluteus maximus getting stretched, while you are bending forward, the gluteus only should stretch. Today we have dealt about backward bending posture. When I will be teaching you about forward bending postures, then you will be able to clearly demarcate. So these are the sequence. How to remember it? You don't have to remember this by diagram. Remember the 5 joints should be into action. What are the 5 joints? Neck, shoulder, ankle, knee, and the hip joint. Apart from that, you need to do the spinal stretch and sideward bending. This is how one can start. Now, after this, one can practice either warming up techniques of sun salutation or jogging. But if you have people with you, those who are suffering from back stiffness, then in that scenario, you should make them practice the Pavan Muktasana series 2, like the Setu Asana, Pavan Muktasana, the Uttan Padasana, Pad Sanchalan Asana, that is leg rotation. And apart from that, you can make them practice Pavan Muktasana, twisting Naukasana. This can be a flow, but make sure that you have, after this loosening, you have practiced Surya Namaskar or some warming up technique of jogging and something. And then you can take up, this is a basically abdominal strength series, and those people should practice who suffer from back stiffness. Abdominal lower back series. So you can see how it is sequenced. From Setu Asana to Pavan Muktasana, from Pavan Muktasana, you are coming to Naukasana, and from Naukasana, you are moving to twist. So this can be one of the sequence. This can be one of the sequence. Now the practice flow 4. After this group of practices, you need to move to prone where you are practicing Bhujangasana, Ardha Naukasana, followed by Sashankasana. Then this is basically Anjaneyasana Asana, easy Anjaneyasana. And this is half monkey pose, Ardha Hanumanasana. So here what we are doing is preparing the hamstrings and then followed by Parvatasana. Once you are into Parvatasana, then you will practice this Saral Raj Kapotasana. While I was dealing about the Raj Kapotasana, I was telling you to perform this posture so that it will help to improve your forward bending. And you will be also see, if you see people who are not able to touch their heels to the floor while doing mountain pose Parvatasana, if they perform the Saral Raj Kapotasana, they'll be able to do it. Just try doing it. You will find it easier for them to practice that. Then the sequencing of Vyagrasana, and lastly the wide leg child pose or Shashankasana. So that was a quick sequencing we teach to people. So likewise, we have so many sequencing of the posture. If you're interested to get that PDF, then we'll definitely share with you so that you can keep it as a knowledge book with you, knowledge bank, and help the people who are coming to you for yoga sessions. Because most of the people, general public who will come to you will come with back stiffness, hamstring stiffness, lot of tightness in the body. So please show those practice flow slide once. Okay, you want to see it again? Okay, sure. We'll help you out. I'll show you from the first. This is the first one, preparation. Second one is warming up and sun salutation, which is not mentioned here. Then the practice flow 2, Setu Asana, Pavan Muktasana. Then you do this leg raise and then leg rotation. The flow number 3, you do Setu Asana, Pavan Muktasana. You can practice Markatasana, then Naukasana, or even Naukasana and then Markatasana. Both are fine. But this should be performed after Setu Asana. This is a balancing act. Whenever you perform Setu Asana, you need to balance it with the Pavan Muktasana. And then followed by twisting, because which will help to release the erector spinae muscles. So in today's session, we learned about so many contraction about erector spinae, right? So that should be stretched at the end, and the abdominal muscles should be strengthened. What are the abdominal muscles? Tire, transverse abdominis, T for transverse abdominis, I for internal oblique, R for rectus abdominis, and E for external oblique. Then 4, you are doing Bhujangasana, Ardhanauka followed by child pose, then Anjaneyasana, or you also call this Ardhachandrasana. Some people call it as Ardhachandrasana, where these are the hip flexor, you are getting a stretch to the hip flexor. When you have to improve Hanumanasana, if you want that your Hanumanasana should improve, then what will be the postures you need to perform? See, I already have the sequence of posture to be practiced for any advanced postures. If you are interested, you can get that PDF from me directly. And you can see the for Hanuman Asana, what all the preparatory posture has to be done. So that will improve your practice. Finally, half monkey pose, Ardha Hanumanasana, Parvatasana, from Parvatasana to Rajkapotasana, followed by the Tiger Vyagrasana, Sashankasana. So that marks the end. Okay, those who are not into the group, I will share the group link in the chat. Just give me 2 minutes of time. You can join the Anatomy of Yoga Postures group. So you can get updates over here. I'm typing the group link. If you have not joined, you can join through the link. And those who want PDF, yes, join the link, and to the same number you can message for the PDF. You will receive the PDF in the same number about the series, simple series what I have taught you. I have lots of series, so that will help you to take up your sessions in coming future. I am doing this since last 30 years. So definitely with the dedication in yoga, you can learn a lot of things. And those who are not aware, let me just tell you, I am the eighth batch of SDM, alumni of SDM. In fact, tomorrow I'll be there in SDM only. I have a program to attend on Sunday, and we are the first batch of Rajiv Gandhi University of Health Science. So hope this session helped you. As I told you, this will be sharp, crisp session for 1 hour. I'm thankful to you all for your precious time, and definitely this should improve the way you approach towards yoga. So signing off for the day. Thank you so much, everyone, for your precious time. Good night. Sir will help you out with more learnings in the coming future.